I think we should give him a, stand to our feet to introduce Professor Robert Lustig.
So I'm going to pick up where Seam left off. He basically explained the issue of corporate interests in pharma, and I'm going to explain corporate interests in food. You'll see how the two ultimately, shall we say, impact each other. I am looking for the golden ticket, the piece of paper that demonstrates the conspiracy between the two. It's often been said that the food industry created the problem so that the pharma industry could treat it. And that very well may be true, but just like Trump and Russia, we may have difficulty finding the actual document. But we're working on it. So today's talk is corporate wealth or public health, and ultimately you will see why the two are mutually exclusive. So I do have some disclosures as well. I did write these books for the general public, Fat Chance, which is about diet and physical health. I also wrote this book called The Hacking of the American Mind, about diet and behavioral health. Unfortunately, hacking is not here in the UK. I do believe it should be. We actually could call it hacking of the contemporary mind because it is not an American issue at all. So if any of you know about the book, please write letters to your MPs and to your publishers and see if we can get the book over here because I think it's absolutely essential. Yeah, there's a copy right there. Good. All right. And also, since we were talking about real food rocks, I wanted to tell you about a nonprofit. I am the chief science officer for a nonprofit called Eat Real. And REAL is an acronym. It stands for Responsible Epicurean and Agricultural Leadership. We praise the good. We provide a trust mark like LEED certification for buildings or fair trade for coffee and bananas and when people in other countries are treated properly. For hospitals, for medical centers, for restaurants, for school districts that procure, market, and sell real food. So, Jane, wherever you are, we are on this as well, and there's no reason that this could not be in the UK as well as a tool for public education. Okay. So the reason that I'm standing here today, similar to Asim, is this statement by Jeremiah Stemler, one of the fathers of cardiovascular epidemiology. And he said, if a researcher isn't willing to follow his data into the policy arena, who will? Indeed, we need doctors to speak up. We need doctors' voices in this debate. Unfortunately, they tend to get drowned out because perhaps we're not as facile with policy. Well, guess what? We need to be. So today I have three agendas. The first is to explain the three myths of the food industry. The second is the dark forces, and Asim has already given you quite a sampling of the dark forces. And finally, the solutions. In other words, I am going to today give you the story of tobacco, writ large in an even bigger industry with more riding on it and more people dying because of it. But you've heard this story before. We've seen this movie before. So let's start with what happened. This is from 2001. It was published in Nature. And at that time, it was projected that a diabetes prevalence of 151 million people on the planet would increase in 2010 to 221 million. That was the prediction over a 10-year period. That would be an annualized inflation rate of 3.88%. What actually happened was 285 million. That was an annualized inflation rate of 6.55%. In other words, a doubling of the rate that we thought we would see in a disease that has become overwhelming and is chewing through all the healthcare costs in every developed and developing country. And this is an enormous, huge problem because most countries can't even afford the refrigerator to put the insulin in, never mind the insulin. And in the next 4 years, we went up to 422 million for an annualized inflation rate of 10.3%, a tripling in rate. And this is while we are trying to do something, to which I say, WTF. So the only thing we can take away from that is that we are causing diabetes. Not that we are treating it, not that we are preventing it, we are causing it. In fact, the medical profession is causing diabetes. How else can you interpret those data any other way? This is not okay. Now, if you look at where the money goes, so this is projected over time, and you'll notice here's the costs for hospitals, for physicians, for pharma. But here's the total cost for health care in that period of time. And the three do not add up to the total because the rest is going to the care and treatment of chronic metabolic disease. This is breaking the bank of every single healthcare budget anywhere on the planet. And that means it's breaking the budget of every government on the planet. And that includes here as well. Now, there are people in the field who do understand. In fact, Asim mentioned Fiona Godley as being a shining light, and she just 3 weeks ago said pills or public health, and that's kind of right. You know, are we going to do this with statins? Are we going to do this with oral hypoglycemic agents? Are we going to do this with antihypertensives? Or are we going to try to prevent disease? Ultimately, treatment is not prevention. I will argue to you, treatment is not even treatment. Treatment isn't even treatment because treatment treats the symptoms of the disease, not the disease itself. And if you're not treating the disease itself, guess what? It doesn't get better. There are two inconvenient truths that everyone in this entire debacle have just forgotten. Okay? And these are it's a restatement of what Asim told you earlier. Here they are. The first inconvenient truth: there is no rational medical therapy for chronic metabolic disease. Doesn't exist. There's only just long-term treatment. And that's proven on this slide, which came from JAMA Internal Medicine not too long ago, looking at a meta-analysis of type 2 diabetes prevention strategies, both lifestyle on the left and medication on the right. And what you'll notice is that the diamond does not cross 1, so that means there is a relative risk improvement. And you can see the relative risk right here, 0.61 for lifestyle and 0.64 for medication. And everyone knows someone who's been helped by lifestyle, and everyone knows somebody who's been helped by medication, and I don't argue that. However, as Asim also told you, and we did not plan this, okay, the number needed to treat, and that's the important number, is 25. So that means for every one person you try to help with medication or lifestyle, 24 of them are not being helped. And everyone knows the one. And unfortunately, medical science knows the one, but they don't seem to know anything about the other 24. And that is the problem. We have to do better. We must do better because a number needed to treat of 25 just will not cut it. Can't cut it. The second inconvenient truth is you cannot fix healthcare until you fix health. You cannot fix health until you fix diet. And you can't fix diet until you know what the hell is wrong. And what you've been sold over the last 40 years is a bill of goods in order to make the food industry very rich, and unfortunately the pharma industry just as rich at the same time. In fact, there are 6, count them, 6, and everyone please take a photograph of this slide. 6 cellular pathways. They are the cellular pathways to longevity when they work, and they are the cellular pathways to disease when they don't. They are glycation, in other words, like hemoglobin C1 formation, except it happens in cells as well. Oxidative stress, I think that is well aware to all of you in this audience. Inflammation, mitochondrial dysfunction, insulin resistance, the golden ticket as Asim told you, and membrane instability. These are the 6 pathways to either cell health or cell death, and that means your health and your death as well. And here's the thing you don't know. If you look at the actual pathways themselves, absolutely none of these are druggable. maybe inflammation, but that happens to be downstream of the other 5. Okay? Bottom line is they are foodable, but they are not druggable. So until we fix the food, we will not fix these 6 pathways, which means we will not fix these 6 problems, which means we will not fix health or health care. It's about the food, people. Hard stop. And until we fix the food, nothing else will happen, period. So the question is now, okay, what's wrong with the food? So let's go to the 3 myths. The 3 myths of the food industry. The first myth. Well, the obesity epidemic's a disaster, and it's everywhere. It's about obesity. You get fat, you get sick, you get sick because you're fat. It's about obesity. Is that true? Well, here is a scattergram of obesity prevalence country by country on the x-axis and diabetes prevalence country by country on the y-axis. And you would look at this scattergram and you would say, well, Dr. Lustig, very clearly there is a correlation, and indeed there is a correlation, and I don't argue that. But correlation is not concordance. They're not the same thing. Because we have countries that are obese without being diabetic, such as Iceland, Mongolia, Micronesia, and we have countries that are diabetic without being obese, such as India, Pakistan, and China. India and China today have an 11% diabetes prevalence. The United States, the most obese nation on earth, you're not too far behind, but you're still a little behind. You're getting there. We have a 9.4% diabetes prevalence. They have an 11% diabetes prevalence, and they're not fat. If obesity is the cause of diabetes, then how come they have more diabetes than we do? Problem number 1. Problem number 2. Obesity is increasing worldwide at the rate of 2.78% per year. Yet diabetes is increasing worldwide at the rate of 4.07% per year. If diabetes is just a subset of the larger subgroup of obese individuals, then how do you explain that? Well, you can't, because it ain't true. And number 3, and there, by the way, there are several others. I shortened this for time. This is the secular trend of diabetics in the United States, new onset diabetics. And here's the total, okay? And here they are broken up by body weight category. And what you'll notice is that there's been a 25% increase in incidence amongst the obese, but there's also been a 25% increase in incidence amongst the normal weight population. The normal weight population is getting diabetic just as fast as the obese population is getting diabetic. If diabetes is due to obesity, then why does it not seem to respect body weight boundaries? The reason is because obesity is not the problem. Obesity is a marker for the problem. The same things that cause the chronic metabolic disease also cause the obesity. And I can sum it up in one word: insulin. Insulin's the bad guy for both. But insulin doesn't necessarily have to cause obesity. It just causes chronic metabolic disease in everyone else, and I will show you why. No, metabolic syndrome is the problem. And that's where 75% of all the healthcare dollars go, not just in the United States, but in Britain as well. And here is the list of diseases, of which, of course, diabetes is the sentinel disease. But all of these are due to chronic metabolic dysfunction, mitochondrial dysfunction, insulin resistance. Here's an easier way to think of this problem. Okay? This is a Venn diagram of the entire United States population, 240 million adult population. 30% obese, BMI over 30. 70% normal weight, BMI under 30. Everyone is in one of the 2 circles, okay? And you know who you are, okay? Now, the standard mantra from the doctors and the dietitians and the Institute of Medicine and the National Institutes of Health and the White House and Congress and the food industry is the following. 80% of those obese individuals, 80% of those 30%, these 57 million people, they are fat and they are sick because they're fat. And if they would only just diet and exercise, we could solve this problem. After all, we have a number needed to treat of 25. So one of those 25. If they would just diet and exercise, we could solve that one person's problem. Indeed. You know, this is just hogwash, just garbage. Well, it sounds right, but why is it garbage? It's on the slide. Why is it garbage? Well, it is true that 80% of 30% are ill. That's true. But that means 20% of 30% are not. They're metabolically healthy. We have a name for these people, MHO, metabolically healthy obese. They will live a completely normal life, die at a completely normal age, not cost the taxpayer a dime or a pound or a shilling or a farthing or whatever. They're just fat, okay? Healthy fat, if you will. Conversely, 40% of the normal weight population have the exact same diseases as do the obese. 40% of the population gets type 2 diabetes, hypertension, lipid problems, cardiovascular disease, cancer, dementia also. And they get it for the same reasons as do the obese. They're just not obese. Now, if normal weight people get it too, then how can it be about behavior? And when you do the math on 40% of 70% of 168 million, you get 67 million thin, sick people calling the 57 million fat, sick people the problem. And I'll prove it to you. So here are CT scans through the abdomens of two equally weighted people. Notice trunk fat 12.8. One's healthy, one's sick. Which one's sick, A or B? B, right. We know A, he's got big love handles, subcutaneous fat, metabolically healthy obese. B, he's got fat all around the organs. He's got visceral fat. And we have a name for this. It was coined here, right here in London, by Jimmy Bell from UCL, called TOFI. Thin on the outside, fat on the inside, real medical term, 1,500 Medline citations. Go look it up. Okay? So, my question to you, sitting here right now, straight on, are you a TOFI? How do you know? How would you know? Does your doctor know? If you're a doctor, do you tell your patients? And if that's true, what do you do about it? Well, this is why we're here today. The point is, no doctor talks about this. They put you on the scale and say, oh, your weight's fine, and that's the end of the discussion. Excuse me, that isn't even the start of the discussion. And here's why. Okay? It's not even the visceral fat. It turns out it's the liver fat. Okay? And you don't measure that on a scale. The liver fat does not show up on a scale. So here's normal liver. Okay? Nice sinusoids, biocanuliculi, Kupffer cells here. And here's this other thing called fatty liver disease. And you're familiar with it? Okay, it is now 40% of all people. Okay, in the UK and in the United States. It has now supplanted Hep C as the major cause of liver transplantation in the United States, this fatty liver disease. Okay? And you can see the fat vacuolization, you can see the lymphocytes and the macrophages moving in, you can see the start of scarring here. Okay? We've done 2 liver transplants on 15-year-old 400-pound soda drinkers at UCSF. The point is, you don't have to be 400 pounds because this non-alcoholic fatty liver disease is a problem worldwide, and it's a problem in normal weight people. So here's NAFLD prevalence for fat people, and here's NAFLD prevalence for normal weight people. It's still there. And here it is by BMI category for males versus females, so males are worse, but here in the overweight category, notice there's still signal, and for diabetics versus non-diabetics, because in fact, NAFLD is a precursor to diabetes. If you have NAFLD, you are 3.5 times more likely to develop diabetes because of your fatty liver, unrelated to your weight. It is a primary driver. So my question to you is, okay, forget TOFI, are you a NAFLD? And how would you know that? And who's looking for that? And what are you doing to make that happen? And what are you going to do to make it stop? So another way to sort of visualize it, if you will. So here is an MRI fat fraction map on an obese person. Notice love handles, but take a look at that liver. 2.6% liver fat. Normal. Metabolically healthy obese. No problem here. Here's what you would more likely see, okay? Metabolic syndrome, obesity, and take a look at that guy's liver. 24% liver fat, non-alcoholic fatty liver disease, no question. Now take a look at this guy. Notice, no love handles, but take a look at his liver, 23%. This guy is just as sick as this guy. Thin sick, fat healthy. Everybody got it? It's not about obesity, it never was. So the key to the kingdom is it's not about obesity, it's about metabolic dysfunction, and anyone can get it. And that's what makes it a public health crisis. Because obesity is a result of the problem, not a cause. I never want to hear any of you talk about the obesity epidemic ever again. Because that is the food industry's mantra. That is what they use to obfuscate the truth. And you play right into it when you talk about it. It is not about obesity, it is about diabetes. Never mention the word obesity again. Hands up, come on. Thank you. All right. Myth number 2, a calorie is a calorie. Now, in America, in 2013, a video played on every football game the entire year, sponsored by CocaCola. It was called Coming Together, and this is a direct quote from that video. Beating obesity will take action by all of us based on one simple common sense fact. All calories count, no matter where they come from, including Coca-Cola and everything else with calories. So, you can get your calories from carrots, or you can get your calories from cheesecake, or you can get your calories from Coca-Cola, or you can get your calories from kumquats. Doesn't matter. If you eat more than you burn, you will gain weight. If you eat less than you burn, you will lose weight. Therefore, it's about energy balance. Heard that before? It's about calories in and calories out. Therefore, it's about 2 behaviors, gluttony and sloth. Therefore, if you're fat, it's your fault. Therefore, any calorie can be part of a balanced diet. Therefore, don't pick on our calories, go pick on somebody else's calories. All of those come from this same notion that calories are fungible, that it doesn't matter where they come from, because they all come into this one big funnel, into this one engine, okay, and they all get burned the same, and therefore a calorie is a calorie, therefore why would we care where they come from? Okay, this is also a myth. It completely absolves you of the need to understand the concept of nutritional biochemistry. And I will be very honest with the dietitians in the room, this is what you learned in dietary school, is that calories are fungible, that it's about the calories. As far as I'm concerned, the calorie is the single worst measure of anything ever. Does not make sense. And we have the science for it, okay? Because some calories are metabolized differently than others, and some calories cause disease more than others because different calories are metabolized differently by the body. Because a calorie is not a calorie. And I'll prove it to you right now. Let's do the exercise. I understand Dr. Harcum is going to give fiber a bad rap today, so I'm going to give it a good one to prep you. You eat 160 calories in almonds. How many of those calories do you absorb? 130. What happened to the other 30? The fiber in the almonds, the soluble and insoluble fiber, and you need both. One will not do. Both are necessary. Will form a gel on the inside of the intestine. The insoluble fiber, the cellulose, the stringy stuff, will form a lattice work on the inside of the duodenum. The soluble fiber, the pectins, the lectins, the inulin, are globular, will plug the holes in that lattice work, and together they form a secondary impenetrable barrier so that early mono and disaccharides that have been released from digestion will not be absorbed in the duodenum. Therefore, they will not enter the portal vein. Therefore, they will not go to the liver. Therefore, they will not undergo liver fat formation. Therefore, your glycemic excursion is better. You do not develop liver fat. Well, you protect your liver. well, if you didn't absorb them early, then where'd they go? Well, they go further down the intestine to the next part called the jejunum, and that's where the microbiome is. Okay, so you have 10 trillion 10 trillion cells in your body, but you have 100 trillion bacteria in your gut. They outnumber you 10 to 1. Okay, you're just a big bag of bacteria with legs. Well, they got to eat something. Well, what do they eat? Well, they eat what you eat. The question is, how much did you get versus how much did they get? And when you eat the food with its inherent fiber, they got 30 calories that they wouldn't have gotten if you hadn't eaten the fiber. So even though the calories passed your lips, you ate them, you actually didn't get them because they didn't get absorbed. Your bacteria got them. So a calorie is not a calorie because if it came with fiber, it wasn't for you. Protein. So protein's made up of amino acids. Amino acids get burned for energy. Turns out it takes twice as much ATP to deamidate an amino acid to prepare it for the tricarboxylic acid cycle than it does to prepare a carbohydrate for that same burning. So there's a net deficit for protein or amino acids to be burned versus carbohydrate to be burned. So a calorie is not a calorie because if it came from protein, there's a net deficit. Fat. So over here we have omega-3s, heart healthy, anti-inflammatory, anti-Alzheimer's, save your life. And over here we have trans fats, the devil incarnate, will kill you, consumable poison, absolutely the single worst thing you could ever put in your body voluntarily. Okay? One will save your life, one will kill you. They're both 9 calories per gram, but they're not the same, are they? Because a calorie is not a calorie. And finally, of course, fructose and glucose, and of course that's where my work has primarily focused. So let's look at what's happened to our diet in terms of these issues. So 1820, our ancestors getting fruits and vegetables out of the ground consumed about 4 pounds of sugar per year. Going up to about 2000, you can see here's the growth of the sugar industry around the world. It's C&H, Domino, Louisiana, Texas, Hawaii, various other Barbados. So here's stabilization when price equaled demand. Here's the rationing of World War II right here. And here's the advent of processed food right here in 1965. And then, of course, with the dietary guidelines in 1977 saying eat less fat, that meant eat more sugar. And also with the advent of high fructose corn syrup at the same time, things went even more out of control. In other words, there's been a 25-fold increase in the amount of sugar consumed between our ancestors 200 years ago and today. And the question is, what role does that have to play in disease development or progression? Well, you have to understand nutritional biochemistry. So I'm going to do this very quickly. This is a liver cell. Here's a glucose molecule. Turns out only 20% of the glucose that you consume actually makes it to the liver. The other 80% ends up in other organs because every cell in the body can metabolize glucose. The glucose comes in and virtually all of it ends up here as glycogen. Glycogen, liver starch, is completely non-toxic. That's why marathoners carb load before a race, is to raise their hepatic glycogen and muscle glycogen stores. Okay? Now here's another carbohydrate, ethanol. Ethanol is energy, but ethanol primarily ends up in the liver, and it doesn't go to glycogen. It goes here to a lipid droplet. It comes down to acetate, enters the mitochondria, gets thrown off as citrate, and this is the process here in orange called de novo lipogenesis. New fat making, taking something and turning it into fat from a different source. Okay? And some of that fat will not make it out, will precipitate as a lipid droplet. Now you've got alcoholic fatty liver disease. And some of it will make it out as VLDL, and that's the hypertriglyceridemia of alcoholism. Now let's take a look at fructose, this sweet molecule in sugar, which no cell in the body requires. Okay? We have a capacity to metabolize it, a limited capacity, but no cell requires dietary fructose for any biochemical reaction. Therefore, it is not a nutrient. It is an energy source. It is not a nutrient because you don't need it. Turns out 100% of a fructose load ends up in the liver because no other cell in the body can metabolize it. And do you see glycogen anywhere? Doesn't go to glycogen. So it all ends up in the liver. And it comes down here to the mitochondria, enters the mitochondria, does the same thing. Here's the citrate, here's the de novo lipogenesis, here's the lipid droplet, here's the triglyceride, so it's a substrate for obesity and heart disease. Also causes hepatic insulin resistance because of other effects. Just count the arrows. Okay? The bottom line is every single thing that fructose does in the liver cell promotes the diseases of metabolic syndrome. So you say, well, how do we know that that's true? How do we know that that actually happens? Because we've actually tested it, that's why. So this is a study we did that's gotten a lot of press. You've probably seen reports of it. What we did was we took 43 children out of our obesity clinic at UCSF, Latino and African American, high sugar consumers, all with metabolic syndrome. And what we did was we figured out what they were eating on their home diet. We studied them on their home diet. And for the next 9 days, we catered their meals. No added sugar. We gave them fruit. That was their only source of sugar, was in fruit, but no added sugar. We took their percent calories as sugar in their diet from 28% a day to 10% a day. Now, that's worth 350 to 400 calories a day. Now, if you take those kinds of calories out of a diet in over 10 days, you might lose weight. We didn't want them to lose weight. So we had to back something that was equicaloric and equimetabolic. We gave them refined starch. We did a starch for sugar exchange, a glucose for fructose exchange. In the vernacular, we took the pastries out, we put the bagels in. We took the sweetened yogurt out, we put the baked potato chips in. We took the chicken teriyaki out, we put the turkey hot dogs in. Everybody got it? So we didn't give them good food. We gave them crappy food. We gave them processed food. We gave them kid food. Food kids would eat, but it was no added sugar food. And we gave them a scale. And every day we'd call them up on the phone, what'd you weigh? And if they were losing weight, eat more! In order to maintain weight constant over the course of the 10 days. And then we studied them again. So I'm just going to show you a cartoon rather than hard data for these 3 studies, just to explain to you what happened. So, fatty liver, triglycerides, VLDL, not good. 9 days of isocaloric fructose restriction. Liver fat went down by 22%. De novo lipogenesis got cut in half. The VLDL went down by 46%. Most importantly, the insulin kinetics improved, both secretion and sensitivity. In other words, we reversed these kids' metabolic syndrome just by getting rid of the sugar and substituting starch. Now, I'm not telling you starch is a walk in the park. That's not what I'm here to tell you. What I'm telling you is that sugar is 8 times worse. And this has now been corroborated in a separate trial. Was published just in JAMA 2 months ago from UC San Diego and Emory. And we are very excited because I have been saying now for a couple of years that sugar is toxic, and people have been saying to me, what are you talking about? Sugar's just calories. Well, we actually now have the toxic metabolite. So we had the empiric data that sugar was detrimental, unrelated to its calories, but we didn't have the actual mechanism. We now have the actual mechanism. We know what in the cell is going wrong in the liver cell. And it is a process that is affecting this enzyme here called AMP kinase. AMP kinase is the master regulator. It's where metformin works, for those of you who know about metformin. And AMP kinase is under the control of various environmental and nutritional influences and is extraordinarily important because it is the switch in the liver cell that tells the cell to either burn energy to completion or to use carbon fragments for structural growth. You can't do both. You do one or the other. Either you burn it to completion and you make carbon dioxide and ATP, or you take the carbon fragments and turn them into lipids for membranes, or you turn them into ribose for DNA because you're growing. Those are your choices. You can't do both. AMP kinase is the way your cell knows which way the energy goes. Okay? It is like the train switch that gets you on 2 different tracks. So AMP kinase, when it's turned on, will tell the cell to undergo glycolysis, beta oxidation, nitric oxide synthesis, mitochondrial biogenesis to burn to completion, glucose uptake, and autophagy. All good metabolic things. And the things that will stop are lipogenesis, cholesterol synthesis, and gluconeogenesis, and protein synthesis, very specifically to stop cell growth. Burn it or grow it. Those are your choices. This also pertains to cancer for obvious reasons. And if you take a liver and you give it a gain-of-function AMP kinase mutation, you cannot develop fatty liver. You actually protect animals from fatty liver. You cannot cause a fatty liver because no matter how much food you give them, they're going to burn it to completion. They will not generate fat from whatever substrate you gave them. So AMP kinase is pretty friggin' darn important. Okay? Now, if you look at the AMP kinase molecule, it's got 3 subunits, and this gamma subunit has the active site, and there are 3 arginines in there. Okay? Fructose turns out to get turned into a compound called methylglyoxal, which is it's an alpha dicarbonyl. It is an aldehyde and a reactive keto group at the same time. This is it right here. Here's the aldehyde, here's the reactive keto, and it is 250 times more potent than glucose in doing the Maillard reaction. That's the reaction that makes hemoglobin A1C. It's 35 times more potent than fructose, 250 times more potent than glucose. And what we showed is that methylglyoxal gets converted to this compound called D-lactate by glyoxylase 1. It's a detoxification step. We looked at D-lactate levels in obese people, and it is way higher. And we showed in our kids study that the levels of D-lactate went down 38%. And as the D-lactate went down, so did the de novo lipogenesis, and so did the insulin resistance. In other words, the D-lactate drove, because it was methylglyoxal previous, drove those 2 processes. So the methylglyoxal fits in there, basically poisons it, drives the stuff that causes growth, which is what causes chronic disease, and inhibits all the things that are important for keeping you healthy. QED. Now, the American Heart Association has known for years that sugar is a problem and has said so, and I was part of this panel, and we recommended reduction in sugar intake by 3/4, from 22 teaspoons per day down to 9 for males and 6 for females. You now have a sugar tax in order to help. And finally, myth number 3, it's about personal responsibility. So, personal responsibility is an ideology. Okay, it's not written down anywhere. It's not in the Magna Carta. It's not in the Declaration of Independence. It's not. Okay. Who invented personal responsibility? Anybody? The tobacco industry. 1962, they were getting killed on the science. And basically, they had to come up with another reason for you to smoke. Well, nobody put it in your mouth. Nobody lit it for you. Personal responsibility. Now, in order to invoke personal responsibility, you need 4 caveats to be met. Number 1, you have to have knowledge. You have to know what you're doing to be able to exercise personal responsibility. Well, here are the 56 names for sugar. And you don't know them. Okay? Nobody does. Okay? In fact, there are a lot of different names for sugar, and the food industry uses all of them because they can put different ones on the food label in order. So a different sugar can be number 5, number 6, number 7, number 8, number 9. When you add them up, it's number 1. In addition, at least on the American food label, notice there's a percent daily value for everything that's in any product except for 1 item, sugar. You're not allowed to know how much is too much. So you are kept from the knowledge. You have to have access. You have to be able to access your choice. Well, most people can't because they only have convenience stores. They don't even have real food. Affordability. You have to be able to afford your choice, and society has to be able to afford your choice, which right now we cannot. And lastly, your choice cannot hurt anyone else. So for tobacco, we had secondhand smoke. For alcohol, we had car accidents. So what do we have for sugar? The answer is we have an NHS going down the friggin' tubes. In 2013, this article appeared called Profits and Pandemics. And what they said is that when I entered medical school, I learned the old medicine, which was due to infections, and the vector was microbes. Today, doctors have to learn the new medicine, which is about chronic disease, and the vector is multinational corporations. And just like microbes, they learn resistance. So, here's that picture I showed you before of the sugar going up. Now I'm going to overlay on this slide the percent of GDP spent in the United States on healthcare for the same period of time. Everybody ready? What do you see? What do you see? When processed food entered our world, that's when healthcare costs started to climb. Now, this is not cause and effect. This is just temporal relation. But I think I've shown you the cause and effect. And I'm not the only one saying it, because this is from Morgan Stanley, okay, an international global investment bank, looking at economic growth in the United States over the next 20 years, modeling forward in the next 20 years based on a low sugar case here in blue, stabilizing at 2.9%, which is respectable, against a high sugar case. And you'll notice that by 2035, we are reaching a 0.0% economic growth. Now, who is that good for? Is that even good for the food industry? So, now we have to talk about the dark forces. Here are our dark forces right here in the center, and you're familiar with all of them. Basically, if a food has a label, okay, it's one of them, because real food doesn't have a label. Have you noticed? Okay. So how do they do this? Well, how do the dark forces work? They do it with shoddy science. An example, the World Sugar Research Organization says, well, sugar is good because it's 4 calories per gram versus 9 calories per gram, lower energy density. However, what they don't tell you is, let's make a Snackwell cookie, okay, a low-fat cookie. What they do is they're not displacing the fat. What they're doing is they're displacing the water. That's why when you make a cookie with low fat, it doesn't break apart, is because the sugar is still holding on to water. It's a humectant. It keeps it moist. So in fact, the recipe is 2 grams of fat down, 13 grams of carbohydrate up, of which most of it is sugar, and it's 34 calories greater. My colleague Dean Schillinger did a meta-analysis looking at does sugar-sweetened beverages cause obesity and diabetes. He had 60 data points. Turns out 26% had food industry sponsorship. Of those 26 had a negative association. But of the 34 that were independent, 33 had a positive association. So from now on, when you see a meta-analysis, if you do not see industry sponsorship as a variable, as an independent variable, take the meta-analysis and throw it in the circular file. Especially around the food industry, but the pharma industry too. Buying scientists. Here's probably the most bought scientist ever. He was the chairman of the Department of Nutrition at the Harvard School of Public Health, Dr. Fred Astaire. And here are all of this. This was his grad student doodling on the back of a napkin, okay, all of his industry sponsorships back in 1976. This was from the Center for Consumer Freedom, which was hired by the by the Corn Refiners Association to basically undo the Sugar Association because they were fighting for market share. And this is what came out of this report. The Sugar Association hired a company called the Academic Network to organize an external scientific advisory committee to aid in the Sugar Association's scientific endeavors, including differentiating fructose from sugar. The Academic Network's president explained he could provide access to researchers who could influence health policy and consumer opinion. The redacted portion of this, and you all know what redaction is now, that is a doctor who I know very well. Okay, I will not tell you who that doctor is, but I know this doctor very well. And he took money from the Academic Network to write a review article that was supposed to be from the Academic Network, but really was a pass-through from the Sugar Association. Dr. Brian Wansink was actually head of nutrition at the USDA. He is a professor of marketing. He's the one who said, well, if you give people an endless soup bowl, they eat more soup. You know that story? Okay, he has now been completely discredited, his funding's been taken away, and he is without a job because he has been basically been found out. You may have heard about the Global Energy Balance Network. This was Anahad O'Connor exposed. This was Coca-Cola paying off 3 scientists around the United States to basically say obesity was due to a lack of physical activity and that we needed to exercise. It was Dr. James Hill of the University of Colorado, Dr. Stephen Blair of the University of South Carolina, and Dr. Gregory Hand of the University of West Virginia. My nemesis, Dr. John Sievenpiper, who is a meta-analysis expert who does not use industry funding as an independent variable. Here's his conflict of interest statement. Okay? I particularly want to point out that his wife is an employee of Unilever, because they're the ice cream people. Okay? And this is the web of Coca-Cola funded research that has not been disclosed. And there's Sievenpiper down there. In fact, they've pervaded many places, including the CDC. This came out just recently that, in fact, Coca-Cola has been influencing the CDC for years. In fact, they got Brenda Fitzgerald elected CDC director. She has since resigned because of her tobacco holdings, by the way. CDC director, tobacco holdings. Got a problem with that? And in fact, we've known about this for decades. Because this, my colleagues at UCSF, Kristen Carnes, Laura Schmidt, Stan Glantz, found the paper trail from 1965 that showed that this has been going on for decades. In fact, the Sugar Research Foundation sponsored its first coronary research project in '65, a literature review published in the New England Journal of Medicine, which singled out fat and cholesterol as the dietary sources of coronary disease and downplayed evidence that sucrose consumption was also a risk factor. The SRF set the review's objective, contributed articles for inclusion, and received drafts. The SRF's funding and role was not disclosed. It's been a put-up job all along. Everything you knew about nutrition is wrong, and it's been wrong on purpose, for their benefit. Hard stop. Upton Sinclair, the author of The Jungle, which was the precursor to the US Food and Drug Administration, famously said, "It is difficult to get a man to understand something when his salary depends on his not understanding it." Co-opting critics. The Academy of Nutrition and Dietetics take money from big food. 90% of their budget comes from big food. These are the dietitians of America. I went to give a keynote speech at the American Academy of Pediatrics, my home institution in Washington, D.C., and it turned out that the opening ceremonies was sponsored by Coca-Cola, so I had this slide in my slide deck. They would not let me up onto the dais to give the talk until I removed the slide. So I'm showing it to you. American Academy of Family Physicians launches consumer alliance with Coca-Cola. In fact, 94 different public health organizations have received money from Coca-Cola or Pepsi. Some of them medical professionals, some of them government, and some are from industry mouthpieces. Okay. Weakening government oversight. This is a big issue here in the UK. Okay. This was from a concern called Sugar Information, Inc., 1972. Sugar's quick energy can be the willpower you need to eat less. The fat time of day, you're really hungry and ready to eat 2 of everything. Here's how sugar can help, etc. You get the idea? Turned out Sugar Information Inc. went out of business because the FTC, the Federal Trade Commission, filed a lawsuit, and they got rid of them. In response, we now have all of these conservative think tanks that have actually stopped movement and actually promoted the food industry, such as the Heritage Foundation, the American Legislative Exchange Council, etc. Okay? In 2007, 52 European health ministers said, let's stop marketing foods to children. I found our Federal Communications Commissioner and asked her the same question. She said, I expect the food industry to police itself, which is, of course, still going on. In 2010, San Francisco mounted a toy ban for the Happy Meal. You know, so you get the Happy Meal, you get the toy. We said that should not be a coercion to buying the Happy Meal. The toy can be separate. You can buy it for 10 cents. After we did that, 3 states passed a ban on toy bans. Yeah, really. This was her name was Blanche Lincoln. She was the head of the Nutrition Oversight Committee of the Commission on Agriculture, Nutrition, and Forestry in the Senate. And she was up for re-election in 2004 and 2010, and here were her campaign contributions. So you see what's going on. Okay, and now ILSI, the American International Life Sciences Institute, turns out is actually running China's Department of Nutrition for their government. Market saturation. This look familiar? Here are the 10 worst children's cereals. Would you feed your kid a 56% sugar cereal? Would you even feed them a 41% sugar cereal? Well, that's what they're getting in school, Fruit Loops. That's what they're getting in American schools. Okay? And if you look at where the sugar is, 33% of the sugar is in beverages, 16% is in candies, cakes, ice cream, things you would identify as dessert, which means fully 1/2 is in foods you didn't know had it. Yogurt, barbecue sauce, hamburger buns, hamburger meat, bread, salad dressing. So even if we got rid of the stuff we knew about, we would still be double over our limit. They've infiltrated medicine. This is from American Children's Hospital in Texas. AstroTurf groups, this I know will be Asim's favorite. Okay? So in America, we have this thing called Citizens for Health, which has nothing to do with citizens. Okay? It has to do with... This is the IEA, the Institute for Economic Affairs. Mr. Christopher Snowden, I just debated him 6 weeks ago at the Savoy Hotel, and I'm happy to tell you I won. And later, if you like, I will tell you how I won, but I won. This is what he says in this tome called Sweet Truth. Every single thing on this summary is a lie. Not one of them is correct. Not one. Okay, I'm not going to take the time to go through why they are not correct. Look up the volume, okay, and recognize just what kind of propaganda we're talking about here. This, of course, led Asim, myself, and Grant Schofield from New Zealand to write this editorial: "The science against sugar alone is insufficient in tackling the obesity and type 2 diabetes crises. We must also overcome opposition from vested interests." That is where we are today, ladies and gentlemen. Okay? And marketing to children. This, you get it. Okay, and the effect is global too. Okay, and to top it all off, and I know, Sam, I'm way over, I got it. I got to tell you this, okay? This is one of the heads of the Sugar Research Unit for the Institute for Public Health in Cuernavaca, Mexico. You know, Mexico passed the soda tax first, right? You know that, 2013. This is Dr. Simon Barquera, a wonderful guy, and totally in it for all the right reasons. He and his colleagues had spyware infiltrated onto their cell phones. And this is what it said. It said, your daughter is in the hospital. Click here to basically get the spyware onto his phone. Okay, and it has been now since shown that this was an Israeli spyware package purchased by the Mexican food industry from the Mexican government. So, solutions. We have a few. It's a work in progress, to say the least. First is public education. This is called IFIC, the International Food Information Council. This is an industry trade unit. And I love what they said. They said, Dr. Lustig's mantra that not all calories are created equal appears to be resonating with more US consumers, with 1/3 of Americans believing sugars are the source of calories most likely to cause weight gain. By the way, I never said that. Never said that. Remember, it's about diabetes, not obesity. Okay, but even so, I'll take what I can get here. Compared to 11%, and here's the actual survey, and here are the numbers, and you can see a 38% increase in people who believe sugars and carbs are the problem, and 42% who say all the same going down. The same group basically has been turned. So education does work. So keep that in mind. It does work. It takes time. In fact, Mars knows it. They've actually agreed with the USDA guidelines to limit total sugar consumption to 10% of daily energy intake. And they say that industry has to be engaged. Agreed. And guess what? Now Coca-Cola even says it too. How about that? But not everybody. Pepsi asked, the Indian government asked Pepsi to do something because Indra Nooyi, the former chairman of Pepsi, is a Madras, India native, and they said, you're killing our populace. And the fact of the matter is Pepsi has done nothing. And the reason is they tried to do something back in 2006. They introduced the Good For You line, the chia seeds and the hummus and the pretzels. They lost $349 million in 1 year. Wall Street called for her head on a silver platter, saying she took her eye off the ball. The Good For You line disappeared, and they did nothing under Indra Nooyi to improve their product reformulation ever since, because now they're gun shy. Credit Suisse, another international investment bank, said, we believe higher taxation on sugary food and drinks will be the best option to reduce sugar intake and help fund the fast-growing healthcare costs associated with type 2 diabetes and obesity. Another global investment bank calling for taxation. Now, how effed up is that? Think about that. Well, that's exactly what you did. And here's something that you here in the UK really need to understand. This is, you cannot walk away today and not get this. The International Diabetes Federation is a conglomerate of 198 diabetes associations from around the world. They, in 2015, went to Davos to tell the G20 to tax sugar to save lives and money. This is what your Diabetes UK organization has said. Okay? With type 2 diabetes, we know sugar doesn't directly cause it, but you are more likely to get type 2 diabetes if you are overweight. Okay? Find more about cutting down on sugar, but they just took a 500,000 pound grant from Pepsi-Cola. You have work to do. In fact, as you know, you have a UK sugar tax because the data are there, because the science is there. Science works, but we do have to overcome the opposition from vested interests. Science alone is not enough. Okay? And they're taxing all over the world. In fact, here are the taxes. So you're not alone. People are getting it. It's happening. It's happening on our watch. It takes a generation. Okay? And I'll explain why as my last comment. So the questions to leave today with: can our toxic environment be changed without government or societal intervention, especially when there are potentially addictive substances involved? Number two, can we afford to wait to enact these public health measures when healthcare will be bankrupt due to chronic metabolic disease? We never had this problem with tobacco, but we have it with this. And lastly, can 6-month-old obese babies change the medical profession, or the food industry, or Washington, or London? Because if you're already obese when you're a newborn, you know something's wrong. So, there are ways to do it. There's public education, there's real food, there's impacting business. We're doing that. We're impacting insurance companies. Government agency action, which has to take place. Unfortunately, some of the government agencies, as Asim and I both know, are co-opted, and there are legal recourses. And I think that ultimately, you here in the UK will have to adopt some of those. So in conclusion, this is a public health crisis because it is an exposure. Even in normal weight people, processed food is the exposure, because processed food is high sugar, low fiber. Real food is low sugar, high fiber. It's just that simple. The food industry has adulterated our food supply for profit. The industry has bought off scientists and co-opted critics in order to do it. Most of the checks and balances have been eroded. Government has been complacent and in some cases even complicit. And our best chances right now are public education, business, and legal action. This is a generational shift. There have been count them, 4 cultural tectonic shifts in the last 30 years. Bicycle helmets and seatbelts, smoking in public places, drunk driving, condoms in bathrooms. 30 years ago, if a legislator had stood up in a state house or in Congress or in Parliament and proposed something for any of those, they'd have gotten laughed right out of town. Nanny state, liberty interest, get out of my kitchen, get out of my bedroom, get out of my bathroom, get out of my car. Today, they're all facts of life. No one's belly aching about any of these. And if you do not buckle up when you leave your driveway, your kid will scream at you. Now, how'd that happen? We taught the children. And then the children grew up. And then they voted. And the naysayers, they're dead. It takes 30 years. We are about 8 years into this. We have about 20 to go. Do not be frustrated. Do not be daunted. Do not be complacent. This requires constant pressure. You must keep up the work. We will all work together. You have no choice. You have no choice. We're in it together. I'm delighted you're here, and I'm delighted you're on board. We will fix this problem together. Thank you.